Welcome, everyone. I'm Cam Gordon. I'm chair of the Health, Energy, Environment Committee, and I'm going to call this meeting to order today. I'm glad to have you here. I'm joined today by Council Members Bender, Andrew Johnson, who's back, Elizabeth Glidden, and Alondra Cano. Jacob Fry won't be joining us today. He's just got married and he's on a little vacation. We have on our agenda quite a few items. We have 12 items on the agenda. We have 4 discussion items. One of them has been added. That's the 12th item, which is receiving a report on the petition to amend the city charter regarding police professional liability insurance. We also have 1 public hearing. And first, I'm going to take the consent items, and we have 5 of those. There's 1 consent item that I'm going to move a staff direction on, and that's item number 5. So I'm going to move items 2, 3, 4, and 6 first. And those are item number 2 is approving the city council appointment of Donald Warnick for seat 6 from Ward 5 to the Homegrown Minneapolis Food Council for the remainder of the current term ending December 31st, 2017. Item 3 is accepting a Minnesota Pollution Control Agency grant of $10,000 to support the Green Zone Work Group. Item number 4 is accepting a grant from the National Fish and Wildlife Foundation in the amount of $80,000 for adding pollinator habitat to the city. Item 5 I'm going to pull for a staff direction. And item 6 is authorizing a contract with Pillsbury United and Cultural Wellness Center in the amount of $62,000 for each to provide services for reducing chronic disease and increasing healthy living opportunities. Anybody want to pull items, any of those items, 2, 3, 4, or 6? All right, then I'm going to actually move the other 2 consent items. Sorry about that. I missed that. We have 2 more. One of them is item 7, confirming the mayoral appointment of Evan Hens-Peter to the Minneapolis Advisory Committee on People with Disabilities. And the 8th item is approving funding for our One Minneapolis Fund, $182,000 for the 2016 One Minneapolis Fund program, to the African Chamber of Commerce, $25,000, ANYA, $1,000, Circle of Discipline, $25,000, From Death to Life, $20,000, the Dial Group, $15,000, Emerge Community Development, $25,000, Givers Foundation, Black Market, Minnesota, $17,000, Lake Street Council, $10,000, LVY Foundation, $19,000, We Win Institute, $25,000. So on those items, 2 through 8, excluding item 5, anybody want to discuss any of those? Seeing no discussion, then all those in favor, please say aye.
Aye.
Those motions carry. Then on item 5, there's a staff direction I'll read and I'll also pass out. This has to do with approving $10,000 grant to support the Senior Skyway Center downtown. Council members and others might recall that we discussed some funding of this and got some funding in the past to make sure they could operate up to September. The understanding is with this $10,000, this can support the Skyway Center operating hopefully to the end of the year. My staff directions are kind of raising the question about what are we going to do after that? Is this something the health department in the city should stay engaged and involved in? Should we support it with our own funding? And in order to help us get some guidance on that, I have a staff direction. The first item would request that the Advisory Committee on Aging review the relationship of the Senior Skyway Center and the Minneapolis for a Lifetime strategic plan and make recommendations about the city's role in supporting the Skyway Center in the future. The second item would direct Health Department and Neighborhood and Community Relations staff to work with the Advisory Committee on Aging and other staff as needed to explore options and make recommendations concerning the future of the Senior Skyway Center and report back to this committee in September of this year. Any questions on those staff directions? Councilmember Glidden?
So I don't know that I know enough about this project, but to understand who are all the project partners, but I just want to make sure that we have the flexibility in here to include staff that probably we need some finance staff too. And I just want to make sure we've got the right city partners at the table to help prep up the work for the committee to give some input on. The other thing is, I would think if there is a recommendation, we want to align that with our budget process. There's a history on this center, and that's part of the challenge here is that the sustainable funding is not there, and we're kind of struggling for what is the next option. So, all right.
Yeah, and I agree with both of those. So when it said other staff, I think the understanding was finance, but we could explicitly say that. Also,
I just don't know with what all the relationships have been, or if CPED has been a partner, if it's just been health overseeing this role and the grant funding and all of that. So,
and we can get more information on that, or we could even have some staff speak now. But it's basically been the health department, and the funding has all come from the outside. But it's the health department has kind of served as the fiscal agent and supported it in that way. So we have yet to put any actual city money into this endeavor over the many years it's been up and running. And so that's why this is something we really have to think about moving forward. Would you like to put finance staff in the staff direction, or?
Well, it sounds like it's flexible enough that it could include finance staff. I just wanted to raise that so that we kind of have a full complement of the staff that normally would touch things like this to be involved in helping put together background information and then seeking input from the committee, but also involving staff and helping make any recommendation to the council as a whole on this.
I appreciate that too, and I think that's the intention with that understanding. Any other questions? All those in favor then of both, I'd just like to vote on it as one package rather than amending it. So we're, I'd like, but let's vote. Let's not do that. Let's just vote on the staff direction. All those in favor, please say aye.
Aye.
And now let's vote on the original action, which is to receive the $10,000 from thanks for bearing with me. Hennepin County Medical Center. Thank you so much, Hennepin County Medical Center. And the amount of $10,000 to support operating expenses at the Skyway Senior Center. All those in favor say aye.
Aye.
Any opposed? Any abstentions? That motion carries as well. Now we're going to go back to item number 1, which is the Neighborhood Community Relations Engagement Commission appointments. And I'm going to move an amendment to the proposed recommendation that we had on the agenda coming from staff. I think I've informed all council members of this and also the applicants involved. But there's been some discussions, and at the request of the council president, in the interest of getting someone with more experience and also with the consent of the 7th Ward council member who supports this action as well, I'm going to approve replacing Stephanie Jones with Jeff Strand so that we would approve the following city council appointments for 2-year terms beginning 2016 and ending 2018 of Shannon Bean, Jeffrey Strand, and Patricia Vogel, and also confirming the mayoral reappointment of David Zaffron for a 2-year term beginning July 2016 and ending June 18. Now, this actually has a public hearing, so I just wanted to make sure that people know that's what I'm intending to move forward. And I will open the public hearing in case anybody has come to speak on this matter. There's lots of people here, but I see that you're more interested in other matters than this one, at least in terms of speaking about it. So seeing no one come forward then, and assuming no one has signed up, then I will close the public hearing. I'll just note that right before the meeting, somebody came up and was curious if these were all actually 2-year terms, because there was some thought somebody was replacing somebody's term. I think it was Tessa's term, which had 1 year left. So let's think about that, and if we have to somehow amend this action, we'll make sure and review that between now and the council meeting so that we make sure that these are indeed all 2-year terms, because we can fix it then. Any discussion on this? Seeing none, then all those in favor, please say aye.
Aye.
Any opposed? That motion carries. And then we're going to move on to item number 9, And soon we'll get it. You can listen to somebody else for a few minutes. So I'm going to, number 9 is a report that we're getting actually from community members. So if you're ready, you can come up to the dais. This is to get public comment from Play It Safe Minneapolis and Healthy Legacy regarding the use of motor vehicle tires or waste tires as ground cover on children's outdoor play areas in Minneapolis. I was approached by this group several weeks ago with concerns about this. It's actually something that we did take up many years ago when there was a football field proposed on Nicollet Island. We're talking about the artificial turf there, which ultimately they used natural turf. But back before some of us were on the council, but 2 of us were, we had our advisory committees look at this, and this was based on the what they call, I believe, tire crumb. There's also something called tire mulch, and I'll let Ms. Doyle tell us a lot more about that. Welcome. Why don't you introduce yourself for the record, and we'll make sure your PowerPoint's ready.
All right. Thank you for the chance to be here. I'm Nancy Brown, and I'm here with Play It Safe Minneapolis, which is a group that I started to get the waste tires removed from Minneapolis schools. It has become clear that this is a bigger issue. I've heard from daycares and other folks in private schools, and there's all sorts of people interested in this issue, and there are cities across the country taking action on this issue, so that's why I was hoping to bring it to you today. So Play It Safe Minneapolis started like a year ago after I smelled the tires that were on our kids' playground. I used to be on the board of an organization called Preventing Harm Minnesota, which was dedicated to getting toxins out of kids' lives. So I knew that whatever that odor was is what my kids were breathing and immersed in. So I, of course, eventually looked it up. You kind of assume these things are safe, and then you look it up, and then you regret that you did. But it turns out there's all sorts of known carcinogens, known irritants. I'll get into some of the concerning materials. They're tires. They are recycled, but they're actually not intended to be recycled, or certainly not intended to be used as a children's product. So one of our goals is to get the tires replaced in Minneapolis schools. We're also working and supporting some work that's happening on the state level around this issue too. So let me just start with, and I know I need to be brief, but I'm just going to start with what this stuff is. I actually have a sample of it. It is actually cut up tires. There's bigger pieces that are called rubber mulch. I don't call them mulch because they don't act like mulch, which is a natural product. But they're cut in approximately the size of mulch, and actually are sold for gardens as well as playgrounds. And then there's some smaller pieces that are used as cushioning on synthetic turf fields. So they're 2 different things. They're 2 different sizes, but it's the identical material. And a lot of the concerns that have been raised across the country and actually around the world at this point about synthetic turf fields, a lot of them relate to the toxins that are known to be present in waste tires. So these are the tire pellets in the synthetic turf, and then there's the mulch is used to cushion falls, just as sand is still in all of our parks, and engineered wood fiber is another commonly used alternative as well. Wood chips is another alternative. So how did these end up in our playgrounds? I just want to address that really quickly. It was in my mind, misguided solution to a waste tire problem. One of many misguided solutions to waste tire problems. We had mountains of waste tires all over this country. They were leaching toxins into the ground, into the groundwater, and they were causing significant health concerns because they would ignite and the fires couldn't be put out, and they would release all their toxins into the air. So the EPA got together with the rubber industry a couple decades ago and worked on a plan to promote and market the reuse of waste tires. And the idea of putting them in playgrounds is one of the ideas that they had. And they talked about the marketing barriers that relate to waste tires. One of them was leachate, toxic fumes, health concerns, and environmental concerns. And in the suggestions column, it was to find and identify champions in every state who could promote the reuse of waste tires in playgrounds and for other uses. So, so this has successfully reduced waste tire stockpiles across the country. The crazy thing is now I think there's 14,000 fields and playgrounds that have waste tires, and we are now importing waste tires to meet the demand for these fields. They are also now hauling waste tires out of the ocean because they thought that would be a good way to use them, is to provide aquatic habitat, but that has turned out really badly too, so they're dragging them up from the ocean now. Okay, so what's in waste tires? You know, it's whatever's in rubber processing process. It's a number of chemicals, metals, phthalates, PAHs, latex, carbon black, nanotubes, which the lungs treat as asbestos, and that's 30% of the tires by volume. So there's a lot of bad stuff in it. Nobody really disagrees about that. Where the disagreement is how much exposure is how bad. So this is what was an education for me, as I assumed it was safe until I smelled it. And then I realized it's not safe. And now I found out that actually a lot of people know that there's a lot of stuff coming out of it. It's just that people aren't sure how much we should expose kids to. So the primary exposure pathways for this material is ingestion, dermal absorption, that is absorption through the skin, and inhalation. And I've talked to parents whose kids chew on it like gum, and many parents who talk about they're having their kids stand in the bathtub and scrubbing off this black residue from their arms and legs and watching this river of black go down the drain. That is all of the contents of waste tires on the kids. And then inhalation is what is off-gassing from the tires, especially because it heats up to high levels. So just like when synthetic turf, this waste tire material is very hot. That temperature was taken, I believe that's a Duluth picture, on a 77-degree day, 127 degrees over the mulch. And another thing that is included in this picture is a hand sanitizer, which our kids only are given a dose of hand sanitizer between playing in the waste tires and going to lunch, rather than hand washing, which is what's recommended. And hand sanitizer actually increases absorption of toxins. So that's actually the opposite of what we should be doing. A Yale School of Engineering study found 96 chemicals in 14 samples they took. Half of these have no safe levels established for humans at all. That means the only thing definitively we can say about safety is that we cannot say this material is safe. And there's a quote from a Yale professor talking about it's irresponsible to market this as a consumer product. I will say that everybody who's put these in, I believe, has put them in with good intentions. It's marketed as recycled material, totally non-toxic. I've looked at the website. This is some of the help that they got from the EPA, is marketing help. So it is an appealing product until you find out what's in it. Duluth did a study where they found 12 out of the 13 chemicals identified are on the Minnesota Department of Health's list of chemicals of high concern. And that the mulch that was in Duluth and would be here would exceed European standards, would not be allowed in playgrounds in Europe. We have different standards, as many of you are aware, probably, for toxins in this country. So there's a lot of alternatives to waste tires, the best of which for playgrounds is called engineered wood fiber. It's a shredded, bouncy wood product that's totally non-toxic. So we're supporting any alternative that is non-toxic. There's also some state level action on this. Senator Hayden and Representative Clark are authoring a bill that calls for a moratorium on any public funding for this material for 3 years, and also a signage that would say that you should wash your hands, avoid tracking this anywhere, keep beverages closed, basically ways to reduce exposure to these toxins. Healthy Legacy is a partnership of a number of environmental and human health organizations, and they deal with toxins in kids. So we're really glad that they've taken up this issue. So there's other communities that are doing good things. City of Hartford just banned this material. North Shore Board of Education in Long Island just voted to remove it. Seattle Parks and Rec just replaced it. Duluth School Board just a few weeks ago unanimously voted to remove it from their playgrounds, which is a real great thing. Also, the city of Edina, there's a parent-led effort to keep synthetic fields from going in. They so far haven't been successful, but that's an ongoing effort in Edina. The other thing that we really want to note, especially that we think the city should pay attention to, is the fact that all these tire pieces are getting into our water system. And the city of Santa Monica prohibits plastic or rubber pellets via its stormwater code and actually charges $10,000 per pellet that makes its way to the ocean. So, so this is a concern beyond playgrounds because this material actually migrates out and goes a lot of other places. So what there has been some. Excuse me. This is our really good PowerPoint expert. Have these things all come up one after another. So there's been a lot of action around the country. There's also action around the world. There's a lot of cases of cancer among young athletes who have been playing on this material. There's lawyers taking class action. Claimants for those lawsuits. It hasn't definitively been tied to the cancerous materials in the tires, but our approach is that we should think about precaution and prevention instead of waiting until there's a lot of cases of cancer. And that's also supported by the World Health Organization, which advocates a precautionary approach on any new materials or technologies, especially when we know that there's reasons for concern. My understanding is that the CEAC and the Public Health Advisory Committee did take a position on this issue in 2008. They encouraged the city to keep an eye on the materials and the research. And there has been new research since that time, too. There was a 2012 study out of Spain that said that this should be a matter of significant regulatory concern, and there's very high levels of PAHs and other toxins. So there's studies all over the map. There's studies that the industry has given to many of the school boards that say that there's no serious long-term health concerns. So our question is what is serious when there's other options that do not provide any health risks or concerns. So we're just encouraging the city to investigate this because it is bigger than a school issue, and it's really something that concerns all the kids in the city and also our environment as it relates to our water and soil and other things.
Thank you very much. If you could stay there for a minute, there's a question for you, at least one question. And then also this, we'll be opening it up if anybody else has comments, and I know that at least one other person does. Councilmember Johnson.
Thank you, Mr. Chair. I have a question and then a comment, if it's okay to do the comment after. Yeah. My question for you is, I know Nike has prided themselves on their program to recycle shoe soles and crush them up and turn them into playground mulch. Yeah. And I'm wondering if that has the same or similar effects that you're seeing as tires, if that should also be part of this target.
That's a good question. There is a product called Nike Grind. You know, I don't know. I guess the concern is what they put in the tires, the shoe soles are whatever shoe soles need, and that what they put in tires are whatever they need to make tires last a long time, without any concern to whether it's safe for children to eat and breathe. So I think we kind of need to go back upstream and figure out, are they making this stuff so that it's non-toxic, so that end use is safe? I would guess that it isn't, but I haven't seen any studies about exactly the composition of those materials. But I think the safest approach is engineered wood fiber on playgrounds, and then there are actually alternative infills for synthetic turf fields, including cork, and there's 3 or 4 commonly used alternatives for the cushioning for synthetic turf fields. So I would be hesitant to use a different recycled product unless we really had confidence that it was safe.
That's very fair. And then just a comment, thank you very much for your work on this. I actually am very familiar with that odor because I go work out at Vertical Endeavors. I do rock climbing, and they have the fill in there, and especially at their St. Paul location, they must use the tires, and you go in and it just hits you in the face, that those chemicals. And I think even beyond cancer, the ability of volatile organic compounds to act as endocrine disruptors and affect hormones in our youth and their developing bodies, and suppress the immune functions, and all sorts of negative health impacts from these is just amazing. And as you pointed out, in a lot of these cases, it's when it's that heat, both applying, that it increases and accelerates the off-gassing, but then as well, the ultraviolet light hitting those compounds in the air, and when they're breathed in, just pardon the pun, or the choice of words, but compounds the issue. Yeah. And so it's really bad stuff, and I really appreciate your effort on this. I think we should ultimately ban it in the city. But one thing I would mention to my colleagues, and perhaps this is more encouragement for the park board and the school board and our state legislatures, is I do think we have some restrictions around the city being able to tell other government jurisdictions specifically what to do. So I would definitely encourage the park board to eliminate this particular type of turf, if you will, or filler material. The same thing with the school board, and hopefully through our Intergovernmental Relations Committee, we can support efforts of our friends at the state who are working on a ban for this. So
that would be great. I also want to call your attention to a letter by Dr. Philip Landrigan. He is considered the father of children's environmental medicine. He's at Mount Sinai in New York, and I have a copy of his letter there for you. And it talks about the fact that there's really no safe levels of these materials for children. And there's so much we don't know, and actually it would be unethical to do the kind of longitudinal studies exposing kids to these materials over long periods of time to find out how dangerous they were. I will say that the person who started this work with me, Casey Roberts, is a nurse. She's also 9 months pregnant. And I talked to her recently, and she said, they are actually planning to move out of Minneapolis. And she said, I'm so sorry, but I have to think about the health of my kids. And they're going to move to St. Paul, where they actually use engineered wood fiber on their playground. So I said, I totally support you. We have to get rid of this for all kids, but everybody has to make their own decision in terms of what's safe for their children. But it is a concern that especially in some communities where they are less able to pay for replacement, it's harder to raise the money for a replacement. There's kids who already are getting more than their fair share of the toxic load of all these environmental toxins. So we just want to make sure that kids throughout the city, regardless of where they are, what neighborhood they live in, are equally protected from things like this. It's just one more toxic exposure that's actually totally preventable and avoidable. So we feel like we should take those opportunities when we can. So thank you.
I just have one last question. You mentioned St. Paul and you mentioned Duluth. Are there any cities in Minnesota that have taken regulatory action to prevent exposure to waste tires?
I don't believe there have been. Rochester, Minnesota, there's also a campaign in Rochester. I believe that's to get it out of the schools. And that also already happened in Minnetonka. Yes, city action has been New York and LA several years ago said that they would no longer be using it in the cities. And that was, I think, in 2008 and 2009. And then Montgomery County, Maryland, there's different counties that have taken action. There's states that have stopped funding the installation of these materials. There are a number of states now that have just continued historically funding installation. So that's something we have to think about, is kind of one hand is putting it in while the other hand is taking it out. But I don't know of any other city action yet in Minnesota. And in fact, there's campaigns really around the country around this stuff. And so there has been a corresponding increase of public relations from the tire industry that this stuff is safe. But actually, any action would be very useful to all the people and cities around the country that are trying to work on this issue. And it's just one of those things that we really need to eventually go upstream and figure out, why was this ever allowed into our communities, because we really shouldn't have to put in this kind of volunteer effort, state by state, city by city, to get it all removed. So that's a bigger problem that has to do with other things, as you know.
Well, I appreciate your time. And, sorry, we have another comment and question. Yes. Sorry.
Thanks,
Didn't
Cam.
see that.
All right. Hi, Nancy. Nice to see you. Nancy and Eric kind of live somewhat close to each other.
Neighbors? Yeah.
And had communicated about this, although it's been about a year ago. And so I just want to say your presentation was really very helpful and instructive, not a topic that I had delved into myself, beyond kind of the high level we communicated at about a year ago. And Councilmember Gordon has reminded me that we do have a position in our current legislative agenda. I think it may have been there for some time, which is why I didn't immediately remember it, which includes support of health study of synthetic turf and crumb rubber, including a comparable analysis of alternatives. So I would say with that, we kind of officially support these bills that you talked about that are one way to have the state take some more direct action to evaluate and have a policy on that. and it's helpful too to hear what is happening around the state with different actions taken by different jurisdictions. I was curious if you had any update for us about what conversation has happened beyond kind of a staff level at Minneapolis Public Schools, just so we can understand what is happening there with their evaluation of this product's use.
So the one short answer is I'm not exactly sure what's happening with the schools. We have gotten a number of emails back for quite a while from the schools. We have talked to the head of facilities at the schools who said he was agnostic on this issue and would be willing to replace the tires wherever there was money raised to replace it. That was originally suggested to me, which I obviously was concerned about because it would mean only the wealthier schools would replace the tires. But apparently, actually, Pratt never put the tires in or immediately took them out because there was parent concerns expressed immediately when the tires were put in. My understanding is that the Minneapolis schools have halted completing the conversion of all their playgrounds to tires, which they were almost done with. But they are trying to figure out, and it involves talking to their lawyers. And so that's what we've heard back for quite a while from the schools. We just had an article in the Minnesota Daily last week about this issue, and it looks like Lee Setter, who is the environmental and environmental person at the school district, said that their concern is about fall attenuation, impact attenuation, which is basically having something bouncy enough for kids to fall on, which engineered wood fiber acts the same on that measure. And it's also, I think, really helpful it would be helpful to actually look into actual real injury data about falls because the parks all use sand. A lot of districts use wood chips, a lot use engineered wood fiber, but Minneapolis has so far been reluctant to make a change. I think partly due to cost. They're just, I think, trying to figure it out still. And we do have plans. We have Diana Kennedy, who had hoped to be here today, is working on this now and has done some really good planning around meeting with school board members and things. And we do have a couple of very supportive members of the school board, too, who are helping us. So I think it's moving, but I was assuming, of course, that I could bring this to them and they'd say, oh, we had no idea. Let's take this out yesterday. So it turns out that's not how it works. So we've been talking to them for the last year and however long, and providing information, and we're going to be doing more of that this summer and next year.
Thank you very much. Now, seeing no further questions, I know that at least one person signed up to speak on this issue. Also, is Nancy Pyramus here? And did you sign up to speak on this issue, Nancy? Okay. I hope you get that chance. Then, is there anybody else who'd like to speak on it who's here? Yes, sir. Come forward and tell us your name and address. Okay, if there's somebody else, you can line up over here too.
Thank you, council members. My name is Emmanuel Ortiz. I'm a 9th Ward resident, Powderhorn Park, lifelong soccer player. And I've been involved in paying attention to the park's 20-year master plan process that is currently underway, particularly in the South Service area, and have been involved with the Parks and Power campaign to bring racial equity into this process, into the city parks. One of the things, and I support the replacement of these crumb rubber fields first and foremost. One of the concerns that I have is the impact that it could have in access to soccer and other athletic opportunities, particularly for young people, for immigrants, for refugees, communities of color, where sports like soccer are very popular and play a very crucial role in social security in these communities. I guess the questions that I know that the city council has approved funding for some of the development of the next 20 years process. My concern is that there should be an economically and racially equitable process for replacing of these fields. In South Minneapolis in particular, there is already a lack of places to play. There's a lack in the city parks of these premier fields that are accessible and safe and durable, these artificial turf fields. So what I would hate to see is that these fields are removed and not quickly replaced or replaced in fair enough time, and it would disrupt the access that the young people in particular have to these field spaces. One of the questions that I have is does the city council have the power to, in this funding process that you all have done with the city parks, to implement some sort of clause that says that these need to be done in a racially and economically equitable way? And I'm curious about the funding that you mentioned, Councilmember Glidden, in terms of the studies of the replacement. I think that's going to be critical. What surfaces or what substances would be viable, durable, and healthier for replacement in these fields? Those are my questions.
Thank you very much.
Good afternoon. My name is Lee Sutter with Minneapolis Public Schools. Thank you very much for.
Thanks for being here.
I wanted to make a few points. I was listening to the discussion. Minneapolis Public Schools is obviously children's safety is of the utmost importance, and I want to kind of go back in time I remember when we first started the move to the rubber mulch. The product was recommended by the Consumer Product Safety Commission as one of the approved products and provided the best fall protection. At the time, we were looking for an alternative from the engineered wood fiber because we were having some problems with it. Most notably, there was concerns about fungus growth and mold growth on the surface. So we had those complaints, but also in Minnesota, one of the phenomenons with the wood mulch, in the wintertime, our kids are still using this play equipment, and it freezes hard as a rock. The rubber during those periods of times doesn't absorb the moisture, and it stays softer. So I want to make sure that the district, obviously, we chose this because we thought it was the safest and the best product for kids, and now these things are coming to light, and our position at this point, like was mentioned, we had a handful of playgrounds yet to be converted from wood or sand to the rubber mulch. We've stopped doing that. We're not adding more. We wanted to yield to the regulatory community for guidance. The studies are being done. The Department of Health has issued directives, not so much directives, but information that they're looking into it. So we wanted to allow that time so that we could have these health concerns fully evaluated. And when that occurs, certainly if it comes out and this is linked to childhood health issues, I don't think there's any question that the district's not going to move forward with a plan to replace it. But we kind of feel like we're in this limbo right now, and we want to be responsible and make the best decision. And that's kind of where we are right now. Cost is an issue. I mean, when we went to the rubber mulch, its initial cost is more expensive than wood, but over time it's more sustainable. It doesn't biodegrade, so it doesn't have to constantly be refilled as often. So from a long-term taxpayer standpoint, that was a consideration, but most importantly, the wood mulch, we're having problems with it, and we looked for a better solution, and this was it. It also provided better ADA access to our playgrounds without adding pathways up to all the equipment. Okay?
Thank you very much. Really appreciate you taking the time to come here. I did reach out to both the school board and the park board before this meeting, knowing that they had a lot of fields and playgrounds. So I appreciate you being here, President Walensky.
Chair Gordon, council members, my name is Liz Walensky, and I'm the president of the Minneapolis Park and Recreation Board. I'm here today as the minority vote at the park board. I have never voted to install any of these artificial turf fields in our playgrounds and play areas because of the safety issues. However, again, I am the minority vote. We do not use any of the Crumb rubber tires in our play areas. We use sand, and we are now in the process of transitioning as we redo the playgrounds into the engineered wood fibers. One of the things you need to know, and because of some information I've heard here today, is we do not have a lot of artificial turf fields. We have a soccer field at Elliott Park, a soccer field at East Phillips Park, a soccer field at Stewart Park. We have a soccer football field at Parade, a football/baseball field at North Commons, and a baseball field in Northeast. These are few and far between. And most of them were done with a grant or grants that were tied to organizations